I'm Dr. Heather Nelson, and here's a 5-minute pedagogy class. Today we're going to talk about the anatomy and physiology of the cricothyroid muscle, or the CT, because nobody wants to say all the syllables all the time. We're going to talk about where it is, what it does, and how you can help your students to train it to work better. Let's first figure out where it is. Here is an anterior or front view of the larynx. This big blue part up here is the thyroid cartilage, and this big plate, that is the lamina of the thyroid cartilage. Down here, you can't see it very well defined in this picture, but trust me, it's there, is the cricoid cartilage. It's ring-shaped and it sits on top of the trachea. This pink part here, that's the CT muscle, and you can see that it attaches at the front part of the cricoid cartilage and then fans back towards the thyroid cartilage and inserts in two different places. I'll show you that in just a minute. Right here in the middle, this part is the cricothyroid ligament. It's stiffer, it doesn't move on its own, and it adds some stability between those two cartilages so they don't fly apart and damage the muscle. Here's a side view of the larynx. Again, we see the big lamina of the thyroid cartilage and then the two sets of horns or cornu of the cartilage. You have the superior and then the inferior cornu. The muscle here, again, you can see that it attaches to the front part of the cricoid cartilage and then fans backwards to insert to the bottom part of the lamina of the thyroid cartilage and the inferior cornu. The muscle itself is also in two parts. You see the yellow part here, that is the pars rectus, and it's just slightly more vertical in nature. And then the blue part here is the pars oblique, and it's oriented a little more horizontally and attaches more to the inferior cornu. Some people also have a third part called the pars media, but it doesn't seem to be any sort of rhyme or reason why people have it or not. And it's more towards the center, the very, very inside portion of the muscle. It seems to be just an anatomical variation, and there doesn't seem to be any advantage to whether you have it or not. And so you'll probably never know if you have the pars media unless someone dissects your muscle, at which point you won't care if you have it anyway. When this muscle contracts, it can move the anatomy around in 3 different ways. It can raise the front portion of the cricoid cartilage a little bit, it can tilt the thyroid cartilage forward, or if the pars oblique contracts, it can slide the thyroid cartilage forward. All of those movements indirectly lengthen the vocal folds themselves, which allows us to sing or speak higher pitches. And so the CT muscle is incredibly important for pitch control, particularly in the higher parts of our range. And conversely, when that muscle relaxes and allows those cartilages to go back to stasis, it allows us to go back lower in our range where our TA muscle tends to take over. Now, remember, all singing starts in the brain. So when you have a student who is coming to you and needs to learn a little bit better pitch control, what we're asking them to do is to sing or speak a certain pitch. The brain will say, okay, I can do that. And so it will send a message down the nerve to the CT, and the CT muscle says, okay, I can do that. And that they coordinate together in order to get you to sing or speak that wanted pitch. When that coordination isn't quite right, the pitch control can be a little wonky, and so it takes a little bit of time for the brain and the CT to kind of get their act together, and then you can have better control over singing and speaking on pitch. Some things that you can do to help train that muscle a little bit are slides. The slides up and down can help that muscle to contract and relax in a measured way, and if you do slow slides, that gives a slow contraction and release, and you can also do fast slides that will allow the muscle to move more quickly. I like to do staccatos or any exercises that have leaps in them for that more fine-tuned pitch control. And that those two things, the slides and leaps, can really help get that CT in better shape. Because pitch control is such a fine movement, the CT muscle has its own nerve. Most structures in the larynx are innervated by the recurrent laryngeal branch of the vagus nerve, but the CT is innervated by the superior laryngeal branch of the vagus nerve. That pitch control is so important. It needs so much brain support that it has its own nerve. And so I hope that learning a little bit about the CT muscle can help you to be as fascinated with the voice as I am. These little muscles that do so much, they're really complex even in their structure, just to help us to sing different notes. If you want to get a little more nerdy about the anatomy and physiology of the voice, you can hit me up for a pedagogy consult. You can find that at my website, drheathernelson.com. Just search for vocology or pedagogy consult, and we can talk a little bit more about how wonderful and mysterious the voice is. I hope you have a wonderful week and happy teaching.